Hello, everyone. This is Ruth Hansten, and I want to talk just a short chat today about how we assign patients under the crisis that you are currently under. Whether you're in contingency or crisis mode or you're just seeing surges, it's really important to think about how we might create different care delivery structures. And be sure, of course, that you are checking with your State Nurse Practice Act, any emergency rulings, any advisory opinions from the Nursing and Medical Board, and look at your state and your organization's crisis standards of care as you proceed. So obviously we know what the 5 rights are for teamwork, and that under these circumstances, we still have to try to figure out the best person to do that task with the right direction and communication and right supervision and feedback. So one of the things I've learned over 25 years of teaching professional practice has to do with thinking versus doing, because for nurses, you know, the idea of doing their practice means that the tasks are intricately woven into their professional practice. They're not used to separating it out. And then you add in the exhaustion and the stress, and they have all these new people that are coming to try to help them that are very frightened and don't know what they're doing yet. And then we've got just that whole fear. So um, what can an RN let go of to have other people do the work? So let's look at the nursing process, and we have all the parts of the nursing process, and the only thing that the RN can really truly let go of are the implementation or the interventions, some interventions to other people. Now, you're asking people to gather data for you for assessment and evaluation and making your diagnosis and all of that, but knowing that it is the tasks that they can let go of. So the coaching questions that I would use for making assignments are these questions. Haven't you ever done that, drive by, walk by, eyeball assessments? What do you learn when you just glance in the room and take a look at that patient? Thousands of things you just pick up on, and you know if that patient's in trouble. Um, Also, what would you assign if you could only observe? Look at the data, keep assessing from the data, but also think and talk. What would you assign? And what would you do if you could not do the care yourself physically? And if you're just in a remote location and watching the situation, how would you allocate care tasks? Some of these thinking coaching questions are to help people move forward. Also, how can we minimize the necessary changing of PPE? If you have a totally COVID positive ward, or unit, it will help with that. And so if you think through dividing up the work, let's say you have 20 COVID patients, okay? So the charge nurse or the nurse in charge is thinking about who is getting better, who is getting worse maybe, and then who's, you're not sure. And then how can I keep updated, and who can I ask to help me with that besides the electronic data, and what tasks need to be done? What are the priority tasks? So if we look at the charge RN role and figure out how you can get respiratory assistance, whether it's a doc, an anesthesiologist, or nurse anesthetist, hopefully you can have a respiratory therapist, maybe use the idea of the proning team. And then functional roles. What are the functions that could be done by a patient care tech or an LPN? And think about putting some of these retirees and other people together with a person from the unit or department, or maybe an educator, so they can begin to check them off and give them some assistance in learning. And with the floats, I get calls and emails about the floats questions all the time, which makes it's very clear that people are frightened about floating into a unit like this, and they need some support and help from unit department people. And if you can pair them with somebody, even if it's a PCT or a patient care tech, do that. So try to do that as best you can. This is very concerning for floating. Cognitive work is your number one priority. Who is going to be an RN that is experienced with this type of patient? Maybe if it's a respiratory nurse or a cardiovascular person, who can best eyeball the data and the patient's progress, and who can keep all these things together and the patient's trajectory clearly in mind. And then what do they need to make the work happen and keep people safe? And um, think about also who can look at who could be moved, discharged, transferred. The technical aspects of care, these are things that you're thinking about all the time, but I'm just mentioning what some of these are, and think about who are the people that you have available that can help you with that. Any kind of the basic care for nursing and hospital management, think about who those people could be. And, even bring in the idea of your chaplain or volunteers, but everybody has to understand isolation and PPE. And, some people are bringing in National Guard and ambulatory care medical assistants and other places where people have been furloughed because surgeries have been stopped for the time being. And I know you surely know this from life in general, but the research on communication shows that, of course, the more people that you're talking to, the more complex the interactions, and it's very difficult. If you watch all these lines going from person to person, you look at how many people you have to talk to, it makes it difficult. So you have to redouble your efforts in communication. And these are our principles that there still isn't a change with the principles, even though we are in a crisis situation. And you get the best people you have to make the assignments based on the 5 rights. If you have questions, I have several articles listed here, as well as the LinkedIn Pulse from 2020, as well as early 21. And if you want to talk to us, we're happy to chat with you more about this if you have questions. Please stay safe.